All right. Hello, everybody. Dr. Bradford here. Welcome to episode 3 of Think Well, Do Well with myself. Going to record this here. Hopefully, my dogs don't start going crazy. I've got 4 dogs at home. Kids are gone. Wife's out shopping. So I thought I'd try to record a video here tonight before everything goes crazy again. Today, I want to talk about diabetes. And I want to talk about 3 tests that your doctor may not have checked. I want to talk about one common test that's checked all the time and kind of explain what that is and why would we even check this and what does it mean. And then I'll finish it up with like a little cooking tip kind of related to that first test. Before I get into that, so this episode, if you're listening, only, you may want to come back and actually watch the video because there's going to be a lot of visuals here explaining things and going through stuff. So you're welcome to listen to it, but watching it may be even better. So first I want to start out with just a statistic here that I think is pretty shocking. 2 out of 5 American adults is pre-diabetic. That's 115 million Americans. That's no small number. And yeah, a lot of people just may not even know that they are pre-diabetic. Why is that important? I mean, diabetes can progress to problems with heart disease, increases risk for stroke, increases risk for all sorts of things. We're still amputating hands and feet and fingers and toes every day in the United States, which because of uncontrolled blood sugar, uncontrolled diabetes, it's an issue and definitely a chronic issue. Definitely something that I don't know. I don't think allopathic medicine is doing a very good job managing this. You know, frequently I'll have patients in my office. They're frustrated because all their doctor wants to do is put them on medications. And when those medications don't work, they start adding more medications and then medications to cover the side effects from the first medications. And it's just, I don't know, it's kind of a depressing downward spiral. If you're not incorporating some natural medicine, certainly some diet changes. I mean, from the get-go, when I'm working with a diabetic patient, you have to cut out carbohydrates. I'm recommending super low carb diets. 20 to 50 grams a day. And that there's no way around it. You can't, I use an analogy of like you're standing in front of a house and it's on fire and you're trying to put the fire out with the little garden hose, and that's the metformin and the other meds. And then, on the other hand, you're throwing wood on the fire with your diet, with lack of exercise, with poor sleep habits, and all the lifestyle stuff that it just, I don't know, it's hard to make any kind of headway if you're not kind of treating it with the whole picture. So 115 million of us Americans are walking around pre-diabetic, and I would say a good majority of those probably don't even know what is going on. So the first test I want to talk about, and these, in my opinion, are I'm only going to cover 4 labs in this episode, 4 labs that I think would be pretty important for any of your doctors to check. One of them your doctors probably checked, the other 3 questionable. I don't see it being checked very often. So the first one that I want to talk about is called Hemoglobin A1c. So what is Hemoglobin A1c and why does it matter? So hemoglobin, your body makes red blood cells, and within those red blood cells are structures called hemoglobin. Hemoglobin is what carries oxygen through the blood supply. So you've got different types of hemoglobin. The most common hemoglobin in the adult is hemoglobin A. So that's where the A comes from. And then 1C, this is a location on that hemoglobin molecule that is important in this blood test. So there is a type of reaction called a Maillard reaction. It comes from the French. There was a French chemist that discovered this reaction. So not Maillard, but Maillard. It's spelled Maillard. And so what happens basically is you've got your red blood cell, you've got hemoglobin within the red blood cell, and then you've got glucose that comes along. Glucose is sugar. It's a simple sugar. And this is what's problematic for the diabetic or the pre-diabetic person. They've lost their ability to handle sugar. And so what happens is when you eat sugar and when you have glucose floating through the bloodstream, some of that sugar is going to attach irreversibly. So it not reversed. It attaches and it stays there, and it attaches to the 1C portion of hemoglobin A. So then, so the red blood cell has a life cycle in the body of 90 to 120 days. So when your doctor is measuring hemoglobin A1c, they're measuring a percentage. The lab report comes back as a percentage of how many of these hemoglobin have had that glucose attached to it. So then now it makes sense that if you have more blood sugar circulating in the body consistently, then more of that glucose is going to attach to the hemoglobin A, the 1C portion of that hemoglobin A. So, diabetes, prediabetes, they are diagnosed using this lab. And there's a certain range for normal, there's a certain range for pre-diabetic, and then there's a certain range for diabetic. In my practice, and I didn't put this on the slide here, but in my practice, I want a hemoglobin A1c between 4.6 and 5.3. The cutoff technically for prediabetes is 5.7%. I want you as far away from that cliff as possible. So A1c, hemoglobin A1c, it's a critical lab to check. If you've never checked it, you should check it. You should ask your doctor for that. Sometimes it's included in an annual blood panel, but usually not, unless maybe the doctor has suspicion to check that. So the next lab, fasting insulin. So this is my little attempt at drawing some pictures in Apple Keynote. So you've got glucose going through the bloodstream. This is my blood vessel. You've got glucose floating through there. Glucose wants to go into the cell. It doesn't want to float around in the bloodstream forever. It wants to go into the cell where it's stored, where you can access it later if you're in a fasted state or if you're exercising. So glucose wants to go into the cell, and it does this primarily because of the action of insulin. So on the surface of your cells, you have receptors for insulin. And so insulin's going to come along, attach to that receptor. That's going to turn on some reactions inside the cell and allow you to bring glucose into the cell. So if you are not responding to that insulin attachment, if insulin's unable to attach to that receptor, then glucose is going to stay elevated in the bloodstream, and your body's going to respond to this by dumping out more insulin into the system. So by checking a fasting insulin level on a blood test, we're able to potentially identify what we call insulin resistance. So your cells are resistant to that attachment of insulin. And so again, so this is number one of the tests that your doctor may or may not be checking. I think it's a critical one to check to be able to look at the whole picture. Is your blood sugar elevated? Is it possibly elevated because you're insulin resistant? So third test, and then second test that your doctor may not be checking, C-peptide. Everyone's talking about peptides these days. Peptides are basically a short chain of amino acids. So you get amino acids, these make peptides, peptides make proteins. So peptides do different things in the body. Insulin would be considered a peptide. So C-peptide, What is this? When your body makes insulin, it's first going to create something called pro-insulin. Pro meaning like before, pre-insulin, I guess you could maybe call it too, but it's technically it's called pro-insulin. So it's a molecule that looks like a C with like a long tail. And then in the pancreas, you've got some enzymes. It's a multi-step process, but you've got some enzymes that'll come in and kind of cut that pro-insulin, cut it, and what remains is something called C-peptide. So that gets left behind, and then insulin is created. So checking C-peptide on blood labs is a way to determine, are you making insulin? And this one becomes important, especially if somebody is injecting insulin, because if you're injecting insulin, then the insulin that you're injecting, that's going to show up on a blood test, and we're not really going to be able to see, are you actually still making insulin? It's a way to kind of double check your work, I guess you could say, because you should be making about 1-to-1. One C-peptide molecule should be seen in the blood compared to one insulin molecule. So it's a way to kind of double check to make sure that the patient is still making insulin. Obviously, in a type 1 diabetic, this is a situation where your body has lost the ability to make insulin. And then in a type 2 diabetic, if you let things go crazy for too long, your body can burn out. You get that insulin resistance building up. You get more dump of insulin into the system. Eventually, that pancreas is going to burn out and not be able to make enough insulin. So this test for me, C-peptide, again, this is information telling me, are you still making insulin, or do we need to intervene with some insulin? All right, the last lab I want to talk about is one called GAD65. So there is a condition called LADA. A lot of people don't know about this. A lot of doctors aren't aware of this. LADA. This is sometimes referred to as type 1.5 diabetes. And the acronym is Latent Autoimmune Diabetes of the Adult. So this is a kind of a halfway between type 1, between type 2. It's like a slow burn of a type 1 diabetes. Patient doesn't necessarily need to go on insulin right away, but potentially that is the treatment that may be required, is to be injecting insulin. So this is an autoimmune condition, and with any autoimmune condition, there's usually an antibody that we can check. So this GAD65 is an antibody that can be checked on blood work. The patient that has LADA, they're going to be an adult. So this is something that happens later on in life. Typically going to be thin, typically going to be relatively fit. We don't usually see the type 2 diabetic type of body and with someone with LADA. So it can be kind of a mystery. And, your traditional type 2 diabetes medicines may not actually be helpful in a person that has this. So GAD65, it's kind of an obscure test. It's not commonly checked. I think some of that has to do with insurance and not wanting to cover that right away. But for me, if it's kind of a mystery diagnosis of diabetes out of the blue in somebody who's been relatively fit their whole life, for sure, I'm checking GAD65. So that kind of rounds out those 4 tests: A1c, hemoglobin A1c, fasting insulin, C-peptide, and GAD65. If you've got some metabolic issues, if you're having trouble losing weight, if you're maybe wondering if you're pre-diabetic or might have some metabolic issues, get these 4 tests. Ask your doctor for them, and if they won't check them, then give me a call. We can do it for you. All right. So the last little piece I want to talk about, this is a little bit of a cooking technique, or a cooking tip, I guess you could say. And this goes back to our old friend, this Maillard reaction. not Mallard, Maillard. So essentially what's happening is there's an interaction between sugar and amino acid, sugar and protein. And this is actually something that can happen when you cook also. If you're cooking, like searing a piece of meat or browning something or grilling, so getting like a char on something, you are creating this Maillard reaction in the food. It's this interaction between the sugars in the food and the protein in the food. And when you do this, you're potentially creating these things called AGEs. AGE stands for Advanced Glycation End Product. And there's potential for cancer risk with this. AGEs can have been shown to be carcinogenic. They will certainly wreak havoc on inflammatory processes, oxidative stress in the body. So the rule of thumb for me with cooking proteins and eating proteins is low and slow. Crock pot, slow cooked, maybe lightly braise meat and then cook it in a slow cooker or in the oven. Low and slow. You're going to really reduce the production of these AGEs, which drive inflammation, drive oxidative stress, and can be a problem in somebody that's dealing with a metabolic disease like prediabetes or diabetes. So that's it. 4 tests. Again, over 100 million of us are walking around with prediabetes. It's an epidemic. It is something that, if it's not you, then maybe somebody in your family or in your close friend group might be dealing with. So certainly not something to ignore. And go get tested. Ask your doctor for these tests. All right. Well, thanks for joining us. My dog's behaved. Looks like we made it through the episode. And thanks for joining us, and we'll see you next time.